Hey everyone, we've got another digital specimen walkthrough today. As always, we're going to be using the Cardioscape platform, which is a digital cardiac anatomy education platform, and we've got over 100 3D models made from 3D scans of actual heart specimens. We've got labels and we've got multiple views for a lot of these specimens, so definitely go ahead and check this out. It's free for Mac, free for Windows, and you can download it at www.learnchd.com. Once again, that's www.learnchd.com, and the link will be in the description below. I've already got a 3D model loaded up here, so we'll go ahead and get started. I'll get these labels off real quick and let's zoom in. And I think a lot of you will already recognize what's going on, but let's get ourselves oriented first. Right now we're looking at the anterior surface of the heart is kind of here, coming out towards the screen. The posterior surface is going inside the screen. Then here's the inferior surface or the legs, and then the superior surface or the head here. And we'll try to identify what we usually start off with, which is the right atrial appendage. Obviously, we've removed some of the walls here, so here's what looks to be in right atrial appendage with pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrial appendage and a morphologic right atrium. Now, when we look at this right atrium, here is the oval fossa. There is an atrial septal defect within the confines of this, so there is an oval fossa type atrial septal defect. Here is the tendon of Totaro. And then here is the mouth of the coronary sinus. And remember, the tendon of Totaro, the mouth of the coronary sinus, and the right-sided atrioventricular junction form a triangle called the triangle of Koch, and at its apex is where we generally expect the atrioventricular node to live. So in this heart, we would roughly expect the AV node to sit here, but obviously it becomes very apparent that this right-sided atrioventricular valve is not in its normal position. But let's take a look at it real quick, and when we do, it appears to have septal connections here. There are connections directly to the ventricular septum. There appear to be 3 leaflets, 1, 2, 3, consistent with the morphologic tricuspid valve. But the atrioventricular valves are usually hinged right at the atrioventricular groove. The right-sided atrioventricular groove is right about here. So we would expect that the valve would have actually sat right along this plane here, such that its opening would actually be parallel to how we're looking at it in our viewpoint, rather than perpendicular here. We can actually look directly down at the valve and see blood would be kind of going towards the ventricular septum and the outflow tract, rather than in the direction of from the right atrium to the right ventricle, meaning that this valve is in fact abnormally rotated. And I purposely use that term rather than inferior displaced, because if this valve was truly inferiorly displaced, it would have to go down this way, and the only way for the tricuspid valve to be inferiorly displaced is if it actually leaves the heart. So in the setting of Ebstein malformation, when we place the heart in attitudinally correct position and not the Valentine orientation, it is best to describe the tricuspid valve as being abnormally rotated around the aortic root. And the aortic root would sit right behind this here, and generally its hinge point over by the septum of the tricuspid valve is relatively in the normal position, but then as you get further out from the ventricular septum, then the valve becomes more and more abnormally rotated and further from where you would expect it to be. And so if we look at these valve leaflets here real quick, here's the anterior leaflet, and you can see that it's actually quite large. It's also not completely delaminated from the underlying ventricular myocardium, and you can appreciate that here as well. And you can see that its trailing edge is right here. So here's the anterior leaflet, often described as sail-like and delaminated, which does appear to be the case in this heart. Here is the septal leaflet, also appears relatively abnormal and not properly excavated from the underlying myocardium. And then here is the inferior leaflet, also not entirely excavated from the underlying myocardium. And you can see that the trailing edge of the inferior leaflet is here. The trailing edge of the septal leaflet is here. So if we just look at the margins of the valve leaflets, or the leading edges, here they are. Which means that everything from the right-sided atrioventricular groove here to the tips of these leaflets here is actually atrialized portion of the right ventricle. And here, beyond the edges of the tricuspid valve, are the actually ventricular portions of the right ventricle then. So a very abnormally rotated tricuspid valve with a large portion of the right ventricle being atrialized, and then a small portion of the right ventricle which truly is morphologically right ventricle. Once again, here's that sail-like, unexcavated or not entirely excavated anterior leaflet of the tricuspid valve. Here's the not properly excavated and dysplastic septal leaflet of the tricuspid valve, and then same here, dysplastic and not fully excavated leaflet, inferior leaflet of the tricuspid valve. The ventricular septum is intact and the left-sided structures are all normal, so we didn't actually include a scan from the left side. So a heart with Ebstein malformation, an oval fossa atrial septal defect, and then, of course, an abnormally rotated tricuspid valve with abnormal valvar leaflets.